Hey everyone, my name is Josh and I study blood flow restriction training. And the goal of these videos is to make blood flow restriction training easy for you so you can better understand it and you can better apply it in practice. Now in this video, I want to go over why blood flow restriction may be a useful tool following an ACL reconstruction. Now one of the biggest challenges following an ACL reconstruction is just trying to maintain leg muscle following the surgery, especially during the first few weeks. Because during the first few weeks, the risk of muscle atrophy is really high because patients, they just can't tolerate the higher intensity exercises that are required to maintain leg muscle. And here's where blood flow restriction can be really useful, because blood flow restriction allows patients to do really light exercise. And when you combine it with blood flow restriction, can create a really meaningful stimulus in the muscle and cause adaptation in the muscle, helping the patient avoid these losses. But what does the research say about the effectiveness of blood flow restriction following an ACL reconstruction? And actually to date, there's been several studies, several meta-analyses, systematic reviews that have investigated the effectiveness of blood flow restriction on the muscle following an ACL reconstruction. Okay, it's actually one of the better studied applications of blood flow restriction. Okay, and what these studies do is they compare a standard rehab program with a rehab program that's combined with blood flow restriction to see, okay, which one's better at improving muscle over time. And what do these studies show? Well, some of them do indeed show that when you combine blood flow restriction to standard rehab programs, that improves the muscle better than just the standard rehab program alone or without blood flow restriction. Okay, but they don't all show this. Okay, some of them show that there is no benefit of blood flow restriction when you add it on to a rehab program. So at this point in the literature, we have these mixed findings. And why is this? Well, one of the reasons is because the studies that have been published so far just differ substantially from each other. Okay, they differ in many different ways. For example, they differ in when the blood flow restriction was started after the surgery, like how many weeks after. They differ in how long that rehab program was, what exercises were used, what cuff pressure was used. And differences in any one of these things can lead to differences in results. The other reason is because these studies have relatively small sample sizes. And when you have a small sample size, it can increase the variability of the data and make it difficult to see an effect, even if an effect is actually there. Okay, it makes it hard to make any conclusive statements. So at this point on this topic, we still need more larger, standardized, randomized controlled trials. Okay, so at this point, the literature isn't completely supportive of the idea that adding blood flow restriction to a rehab program is going to be better than the rehab program alone. But what it is most supportive of is this idea that blood flow restriction can be beneficial early on in recovery. Okay, some of those studies that showed there was no effect of blood flow restriction following a full rehab program did, however, see there was a beneficial effect early on in the recovery period. Okay, so the research does back up this idea that blood flow restriction can be a useful tool in the early phases of recovery when patients can't perform heavier weighted exercises. They only can really do light weighted exercises. Well, if they combine those lightweight exercises, which by themselves probably aren't going to do anything, with blood flow restriction, now they can create a meaningful stimulus and a meaningful adaptation to help them avoid those losses early on in the recovery period. And then as their recovery progresses, they can transition away from blood flow restriction and towards just standard progressive rehab. Okay, and this is actually, as rehab progresses, this is where the research shows that blood flow restriction has less distinct benefits. Okay, so overall, blood flow restriction is not going to completely replace the rehab program, but it can do a good job filling the gap early on in the recovery where patients can't lift heavy weights. Well, they can opt for light weights, combine it with blood flow restriction to avoid those muscle losses. Okay, so in my next video, I'm going to talk about, well, how do you implement this? How do you implement blood flow restriction in the recovery following an ACL reconstruction? We're going to go over some exercises and some training programs that may be useful.